It's that time when we talk about IEPs. I like to give you a tip every week to help us all, myself included, to be able to get through the IEP process as painlessly and as productively as we possibly can. I know I just say the words IEP and I feel like, oh my goodness, I have to put on some armor. But it is my hope, and it's one of my goals and one of my missions in life, that we can get to the point where as parents, we are so educated and so prepared, and that we can get our teachers to the point where they're so prepared and educated. And then, the administrators, I don't know. I don't even know where to go there. But to the point where we can sit down and do IEPs and have what's supposed to happen with no one having to have their blood pressure raised. This is my mission in life for all of us, not just for myself, but I'll admit it for myself as well. So if you're new to the world of autism, let's talk briefly about what an IEP is. An IEP is an individualized education plan or program. And if your child is diagnosed on the autism spectrum, then you should have an IEP. And what it does is makes a clear roadmap for the entire team, everyone who works for the child, to follow while your child is at school. By the way, it's a legal document. And so what you sign, there's a whole process that you sit down in meetings with other people on the team. You're supposed to be an equal and even member of the team. That's supposed to be what happens. And everyone is supposed to have a say in it, and eventually you sign it, and then that becomes the binding contract of the roadmap of what you're going to do to see progress for that year or those 3 years, depending on how often you have an IEP. And every 3 years, everybody has to assess. You don't have to do one every year, but at least every 3 years that your child has an IEP, there has to be a review of, is this thing working? But a lot of people have them every year. Okay, so when your child is someone who is deemed special needs or has a diagnosis of some sort that allows for there to be an IEP, there are certain laws that govern what needs to happen. And you will see that when you go in to have the meeting, the whole process can be whittled down, and I know this is like maybe oversimplifying it, but I think it's important to stay focused, right, on the things that are most important. The school has an obligation. If you live in the United States, every child has a guarantee of what they call FAPE. FAPE, F-A-P-E, stands for Free, Appropriate Public Education. That is what your child is entitled to. It does not matter what your child's ability is. It does not matter what your child's behavioral issues are. Ooh, did you hear that? Your child is entitled to a free, appropriate public education. So when you go into the IEP meeting, there's a couple of things having to do with FAPE that I want you to keep in mind, because this is the crux of what you're going to go in and have a conversation about. That best is not what is appropriate. This is the hardest thing as a parent. Oh my goodness. We've had Bonnie Yates before on the show. She is a special education attorney. She's also an autism mom. Well, she's an ex-autism mom. We've had her son, Nick Yates, on the show before. He is a college student who is about to graduate from college. He's in his final year of college, recovered from autism many, many, many years ago. And Nick is one of my favorite people on the face of the earth. Well, his mom, Bonnie Yates, is a special education attorney. And one of the first things that I had to learn on this journey, and that her office, it was like they had a drill that they wanted to drill into my head, little holes that they would drill around and say, Shannon, you have to remember the word that we're going to use is appropriate, not best. As a parent, you want what's best for your child. How could you want anything else, right? Best is the word you're used to. It's the word that feels comfortable. It makes sense, right? You want what's best for your child. But when you go into IEP meetings, you're going to forget that you ever heard the word best. It doesn't exist in your vocabulary. You're not going to say it. Get used to not saying it. It's there. It's in your gut. We're not denying that. But for the purposes of these meetings, you're going to go in and you're going to use the word appropriate, right? Now, you see my second point here, that appropriate has to be effective. The school is going to pound, appropriate. But appropriate has to be effective, and this is the argument, this is the way that we can accomplish what we need to accomplish in an IEP meeting. 9 times out of 10, this is what the argument comes down to. Sometimes the argument comes down to least restrictive environment, because that's the other part of the equation. Your child has an absolute right, a legal right to a free, appropriate public education in the least restrictive environment in which they can accomplish the goals of the IEP. So what does that mean? When you hear that, what does that mean? Well, it means that if your child has the ability, the academic ability, to keep up with their neurotypical peers, then they have a right to be included. If your child's behavior is such that they are disrupting, that they're preventing their own learning, or disrupting and preventing the learning of others in the classroom, or putting themselves or someone else in harm, you could lose your least restrictive environment and be put in a more restrictive environment. So, you know, I know that it's a case-by-case, parent-by-parent issue, and I always defer to your gut. And if you feel that your child needs to be in a special day class because that is what's right for them, then I have no issue with that whatsoever. I know that you know more about what your child needs than what I do. But I hope that in that special day class, your child's individual needs are actually being met. That we never want to put a child in a special day class to park them. And unfortunately, there are some school systems where that is what happens. I have friends that have cried many tears about the placement that your child has to have real and substantive goals, and they need to be making progress. So if you're okay and you feel like the special day class that they're in, they're making progress, that they haven't just been parked and it's the ideal setting for them, then I am completely in agreement with you. But for some of you, you don't know. Right? You say to me and you say to other people, I'm not sure. Does my child need to be in a special day class, or does my child need to be included? I will make a case for inclusion for you. Inclusion is good for both sides of the equation. It's good for the kids, and they'll make the argument and tell you that it's not good for the other kids in the class. Poppycock. That is not the truth. We've seen study after study that shows that kids who are given access to people who are different from themselves and have different abilities will progress and socially score better on testing, and they are kinder people that do well in the world and have a bigger skill set. Hey, that's good business, right? In terms of education. And for our kids, especially with autism, we see often, not in all cases, but they rise to the level of what is around them. Sometimes we think they don't see behavior around them, but listen, if I'm in a room full of people who are all humming different songs, my ability to concentrate is going to be compromised, right? If I'm in a room with one person humming one song, I might be better at tuning that out. But if I'm in a room with a whole bunch of people who are all humming their own song, eventually I may hum my own song, whether internally or externally, just so that I can key into what I have to do. And the reality for our kids with autism is that a lot of times we will see that they will do better when they are included. They have more opportunities to be social. They have more opportunities to reach higher potential. Not in all cases, but in a lot of cases. So defend your least restrictive environment as closely as you can by making sure that if your child's engaging in a behavior that is threatening that you ask for an FBA, a functional behavior assessment, to be done by somebody, hopefully who's a BCBA, who has experience with autism. Don't give up on your least restrictive environment. Follow your gut, but don't give up on it solely because of behavior. Because there should be a behavior intervention plan that circumvents what's happening. And if there isn't, you gotta ask for it. It's a behavior intervention plan, a BIP, and you can attach it to your IEP. How's that for jargon? But argue for what is appropriate and make sure that what is appropriate is effective. I have seen schools that say, oh, we have this plan, and oh, we have this plan, and oh, we have this plan. And you've walked in and said, here's what I want. And you might think, I don't know what I want. But, every parent I've talked to at some point says, well, really what I want? So you do kind of know. And if you don't, that's okay. Write in. We'll help you to clarify what it is you want. You want progress, right? But if the school is saying to you, well, here is our offer of FAPE. Here is what we have found to be appropriate. And then ask them, is it effective? And they're going to say, of course it's effective. Can you show me some data? Oh. That's when you separate, as they say, the men from the boys. It has to be effective, and make them show you that it's effective. Make them show you. But we're not going to say best in meetings. We're going to say what's appropriate. What's appropriate for my child is X, Y, and Z. And hopefully, if your child's starting out, you may not have data that supports that that's what's effective for your individual child, but we have all kinds of studies here that show that ABA is effective. And if you need access to those, write into us. If you're going into an IEP and you need data that shows that ABA is effective, we have you. We have your back on this one. So don't let them tell you that something is effective unless they can show you studies, because we can show you studies. All right, so that is some of the stuff that we want to be mindful of when we go into an IEP. FAPE, it's what your child is entitled to. Free, appropriate public education. Appropriate is the name of the game, and appropriate has to be effective. We can do this together. Si se puede, right? We can get this IEP thing under control.